After a week-long hiatus following the shooting of Congresswoman Gabby Giffords, the House of Representatives is back on Capitol Hill tonight with more civility, we hope.
Republicans' first order of business is trying to repeal the president's health care overhaul law. But tonight, the White House is skeptical the move will be enough to overturn one of the administration's hardest-fought legislative victories. Samantha Hayes has more now from Washington.
A day before the House of Representatives plans to vote on a repeal of President Barack Obama's health care law, supporters and opponents are taking sides.
We don't think it makes a whole lot of sense to debate a bill that thankfully will go nowhere in the Senate and would certainly be vetoed by the president.
If that's the logic we take on every bill we bring to the floor, then we ought to just go home. We think it's important to define ourselves with our actions, and that's why we're acting.
In an effort to show the human side of health insurance, House Democrats held a hearing with a group of people representative of Americans who would be hurt by a repeal.
Repealing important new consumer rights means not only that my son won't be allowed to stay on our insurance policy until age 26, but they won't see the day when pre-existing conditions don't dictate your ability to get health insurance.
I stand out here.
Outside the Capitol building, Republican Congressman Steve King presented what he said were hundreds of thousands of petitions signed by Americans demanding repeal, and says there's a better way to provide health insurance.
First, we have SCHIP, the State Children's Health Insurance Program, and that's today at 300% of poverty. So if you're above 300% of poverty, I think you could probably afford the premiums for your children. There are a whole list of things that resolve this a lot better than an entire government takeover of health care.
In Washington, I'm Samantha Hayes.